All right, welcome to Advanced Orthogonals Introduction. I'm Dr. Stan Pierce Jr., and we'll be leading you through a little trip here on trying to figure out the complexity of the upper neck and why a specialty procedure as advanced as this procedure is focuses so intently on correcting this upper neck area. When we first look at the anatomical references of what's so unique about the upper cervical spine, you can see from the side x-ray here that most of the neck vertebrae have discs in the front where you can look at the disc spacing to see how healthy the disc is. And in the back you've got the facet joints. Now these facet joints act as interlocking guides, not only to help secure the alignment of the vertebrae to protect the spinal cord, but they also act as angled guides to assist with manipulation or adjustments that are being rendered to other areas of the spine. When you look at the upper neck, the atlas, C2, and the occiput, there is no disc above or below the C1 vertebrae. There is also no interlocking facet joints. So this is a very, very important point that sometimes gets overlooked. If every single vertebrae of the spine has discs in the front and facet joints in the back, helping to keep it stable and to assist with general adjustments to align vertebrae, and the upper neck doesn't have those, that alone has to draw enough attention as to the importance of specializing that upper neck and looking at it as a unique subluxation. It's not like the rest of the spine. Thus, one of the main reasons why there's procedures that have come into play specializing in that area. Now, why would our body develop a uniqueness up there of no discs and no facet joints is to allow for extra motion to living life. Because as a result of the no discs and no facet anatomical situation, over 50% of the movement of the head and neck occur here. You have 15 degrees of flexion and extension occurring between occiput C1. You have 60% of cervical rotation occurring between C1 and C2. Due to this extra motion, it does make it more vulnerable to misalignments. And you have to also consider that it's got a 14 to 16 pound bowling ball sitting on top of it. So why would getting subluxated up here be important? Well, let's take a look. If you look through the top of the head and the C1 and C2 underneath it, you can see where the neural canal goes through, and the brain stem, becoming the spinal cord, goes through there. And you can also see the holes in the arms of the atlas where the transverse foramen are and the vertebral artery passing through there. And you have cerebrospinal fluid flow. Now obviously the cerebrospinal fluid is what nourishes the majority of the brain tissue as well as cushions it, provides extra cushion against trauma or injury. But you have the vertebral arteries, that's the primary blood flow to the middle of the brain. If everything's in good alignment, not only will you have normal flow of both of those fluids, but you'll also have normal nerve distribution down the spinal cord heading out to the supportive spinal erector muscles. And if both sides of the posture muscles have equal tone, you'll have a nice straight vertical spine. If you get the atlas vertebrae out of position, it can cause neurologic disruption in that area due to different theories of insult, and that can start to cause muscles on one side of the spine to get tighter than the other side. And we know that nerves control muscles, and nerves are protected by bones that are in good position. So if the bone gets out of position, interfering with the nerve supply, then the muscles can go out of balance. Now that seems like a simple consideration, but how many people have to go to chronic massage therapy sessions or stretches or acupuncture because of this muscle irregularity? If the muscle irregularity becomes bad enough, it can start to impinge nerves passing through those muscle fibers and can even cause neurologic impingement syndromes due to muscle spasms. But if you also consider the fact the rest of the spine is now torqued, it's now twisted into a scoliotic curve, you have the pelvis being unlevel, now you start to see the potential for a lot of secondary chiropractic problems. And there's many chiropractors that are in a chronic adjusting model of working with these other areas, trying to help the patient. But that the torque spine, the torsion that's on that spine, is being induced by this upper neck misalignment. You can also see in this model the vertebral artery is being strained due to the atlas malposition. And if you start to lose blood flow to the middle of the brain, now you've really complicated a lot of the autonomic functions of the body. You can see here in this study abstract that was written up on a kyphoscoliosis that was being induced from damage to the brainstem. So often people don't look at the spine as an entire unit. They look at individual segments for treatment. But when the atlas goes out of position, you're really looking at a full spine problem. And when we look here, if we complicate that upper neck malposition even further with a counter rotation of the C2 vertebrae in a subluxated state, you can see here as we do it that the C2 is now opposite and creating even further strain not only on the neurologic distribution, but on the vertebral artery blood flow to the midbrain. Intriguing to think about how many times you would actually have to adjust the pelvis and lumbars to correct this spinal torsion. Or maybe we should put a heel lift in their shoe. Actually, we probably should just get the pressure off the brainstem and let the spine untwist first. And there's different models of care that have focused on this upper neck due to these irregularities of function and anatomy. And if you look at it, you have the articular model, which is kind of the more historical beginning of upper cervical care, where B.J. Palmer and the Palmer toggle package, hole-in-one concept, and Blair, Kale, Nichest have all been part of that articular model. Then you have the orthogonal model, which is based upon the Grostic work, and that branched out into orthospinology and NUCA, Atlas orthogonal, and advanced orthogonal. It's often thought that the articular model is in opposition to the orthogonal model and vice versa, but in reality they're both just looking at the upper neck in ways to try to help the patient, and they recognize there's a uniqueness and a specialization that is required to fix the upper neck. B.J. Palmer was known as chiropractic's greatest researcher, and he introduced concepts to us of innate intelligence that runs the body, of subluxated vertebrae. He developed the hole-in-one technique of upper cervical adjusting, and he was the first to use x-rays in order to look at the vertebrae to determine a listing from which you can adjust. One of his, I'll call him a patient, was Dr. Grostic, student as well, and he was diagnosed with Hodgkin's lymphoma at a young age, was treated by B.J. Palmer, and his Hodgkin's went into remission. He then had a recurrence of the Hodgkin's and was unable to be corrected as well by other chiropractors, went back to B.J. Palmer, got adjusted again, and went into remission again. And at that point he realized that we have a problem here because this man in this adjusting can produce unique results that these other chiropractors are having a hard time duplicating. So he went into a mindset of standardizing a more specific analysis of that area and basically refining B.J. Palmer's work to make it more duplicatable. He came up with the measurements of mathematics on the x-rays, looking for degree-specific measurements, the center of gravity of the skull over the neck, looking at pre-post x-rays, talking about holding the adjustment, and talking about lightening up the adjustment for a better control to the correction, using the term lighter is righter. He stated that I believe it necessary that we know these respective degrees before the adjustment is given, so that we will correct them all to their normal degree in the shortest possible length of time. He went on to say that the adjustment should be given with extreme accuracy, governed by the laws of mechanics, mathematics, and physics. The spine being mechanically constructed, mechanically subluxated, and the adjustment being the application of a mechanical force applied to the spine. It is possible to mechanically measure the effectiveness of the adjustment in the cervical area. This is very interesting also because we discuss in chiropractic right now that they're looking at outcome-based measures of evaluating patients' response to care. And the idea of having pre-adjustment measurable factors and being able to have the same post-adjustment measurable factors is helping to standardize the objective approach of assessing a patient's progress in response to care. Therefore, when he makes this statement here, that I have found in post-X-raying cases that one adjustment will completely correct a subluxation, and given time the patient gets well. It's important to realize that Grostic-based procedures look at pre-post X-rays as one of their primary criteria from which to objectify a patient's response to care. The idea of orthogonality came out of Dr. Grostic's work, and he discussed how the vertical axis, which is the y-axis, and the axis shooting out the left ear, called the x-axis. If the skull is directly over the neck and the atlas is perpendicular to that, forming a cross formation, that term is called orthogonal. If you look at the skull through the top and the atlas vertebrae is 90 degrees to the center of the skull's mass on that film, that's also considered orthogonal. So the term orthogonal means having to do with or involving right angles, intersecting at right angles, or mutually perpendicular. Our profession has been around since 1895 and has seen some changes to it for sure. But when we evaluate the amount of technological advancements that have occurred in so many different professions, when you look at a radio, for example, that is now as small as an iPod Shuffle or an MP3 player, when you look at surgeries that used to be so archaic, and now they have the Da Vinci robot trying to minimize infections and maximize accuracy. When you look at people that used to put potions together, to herbalists trying to help patients, and now you can take people's supplementation and customize it to match their genetics. When you look at models of previous decompression methods, and now you have the DRX 9000. You see models of professions that are affecting patients' health care, and we think, well, of course there's technological advancements. That's what time does. It causes human beings to push for further advancements. So what about our profession? What about chiropractic? You can look at hieroglyphics or old sculptures showing different traction methods or manipulation methods, because the idea of spinal manipulation has been around for thousands of years. And yet, how different is it from some of the methods that we still teach or adhere to these days? Here's another example. And yet, how different is it to some of the procedures that we utilize these days? So why hasn't technology improved in the correcting of spinal misalignment? Or has it? Dr. Roy Sweat was one of Dr. Grostik's students, and he saw the dilemma that was occurring with a lot of doctors trying to do the Grostik hand adjustment. It was an adjustment that was very difficult on the doctor physically to do, and was hard to duplicate from practitioner to practitioner. So when Dr. Grostik had passed away, there was several people that had the idea of developing an instrument to try to standardize the adjustment. And Dr. Sweat ended up developing a percussive adjusting instrument. He introduced the idea of scanning palpation, and he modified the analysis templates to improve them some. And he said that adjusting the atlas and the upper cervical area is not a simple procedure. It's as delicate as the most complicated brain surgery, and it requires an endless process of study and dedication. Dr. Stan Pierce Sr., one of Dr. Sweat's associates in training in the Atlas orthogonal work, was one of the original board members of the Atlas orthogonal program and helped with its development. And in the mid-1990s, he began observing the aberrancy of the condyles that can occur in a patient's genetic scenario, and it was able to incorporate that assessment into the orthogonal model. This produced a nice bridge by which the Blair procedure and the orthogonal models of care could be considerate of each other. The aberrancy of the condyles, as well as looking at up to 12 other aberrancies, has become a staple for advanced orthogonal, and the aberrancy of the condyles was initiated by Dr. Pierce. He also went on to establish protocols for table placement for atypical components of a subluxation pattern, calibrating the vectors from the X-ray analysis into the instrument using a laser X and digital Z alignment. He used zoning procedures and 4-point referencing of the atlas plane to minimize the errors that occur with genetic abnormalities being assessed in an typical orthogonal protocol of analysis. Then the axial X-ray and the motorized shoulder piece and the X-ray analysis instruments were all upgrades. And this is the first technique that has progressed to digital X-ray analysis. So when you look at the history of B.J. Palmer's adjustment in a sideline position, and then you can see the Grostic adjustment, which has a more of a superior to inferior line of drive, and then Dr. Sweat developing the percussive instrument, that entire lineage of concept has now advanced into the advanced orthogonal procedure. So when an examination has confirmed the presence of an upper cervical subluxation, X-rays of the patient need to be taken from 3 dimensions. Since we're going to be using a state-of-the-art percussive sound wave adjustment, our procedure is going to be able to offer patients a gentle and precise treatment for the correction of cervical subluxations. The 3 dimensions of X-rays is going to be a lateral view, a view from the top of the patient called a horizontal view, and a view through the front of the patient. And when we draw the lines on the film or on digital analysis, the patient's anatomy is studied for both the genetic abnormalities as well as misaligned vertebrae. The coordinates for correction are calculated through physics and engineering measuring systems and formulas, and the exact line of drive for correction is determined for each patient. This is a very, very important point when you are looking at this procedure and its effectiveness for you on your patients. Because many times you'll hear chiropractors say that you don't really get good at a technique till you're 4, 5, 10 years into practice. And I always remember thinking, well, how am I going to keep those people coming back early on that I'm not really fixing very well? With a procedure that uses measurements, mathematics, and instrument correction, when you have these advanced scientific principles supporting your adjusting protocol, you're able to have a higher likelihood of rendering top quality adjustments right from the get-go. In fact, you can even do it while you're in school. It gives you a major leg up on the rest of the profession and the competition out there in the marketplace, and it gives you the ability to have confidence exude even as a brand new graduate. When we look at the art of sound wave adjusting and the science behind it, you can see here that as we look at the patient's sideline and we look at their skull and atlas, and we bring the instrument in and we calibrate it based upon the X and Z vectors from the X-rays, and we use a painless, precise sound wave adjustment, it'll minimize the patient's discomfort while maximizing the accuracy of the adjustment. A single advanced orthogonal adjustment, when it's done properly, will correct the atlas laterality, the atlas rotation, the C2 rotation, the cervical spine deviation, and it'll improve the weight-bearing center of gravity of the skull to cervical spine. These improvements should be immediately verified by post-X-rays, and when they are all properly corrected at the same time, the patient should obtain a more rapid stability to their care, requiring less and less repeat adjustments. As the advanced orthogonal adjustments performed within a patient's normal range of motion, the ligaments and muscles will be able to adapt more readily and assist with the stabilization process as well. So sometimes there is a public perception or even a medical field's concern that some of the more high force rotary type of adjustments may have a deleterious effect or a negative effect on the ligaments or other soft tissue in the area, since those adjustments often are done outside of a patient's normal range of motion. The advanced orthogonal procedure works within a patient's normal range of motion. Therefore, we're protecting and securing the stability of those ligaments and not causing any potential microtrauma or weakening of them, which would theoretically allow them to be able to adapt and help a patient's structure hold more readily. And looking at an example of a pre-X-ray taken on March 11th, and you can see on the post-X-ray that there has been a vertical improvement of the structure. Here's an example of low backs being twisted and going vertical after the atlas correction, and the patient had a little bit of time of responding to that. And seeing this alone is important because there was always this concept in chiropractic of either working from the bottom up or from the top down. And if asked, you will often find the upper cervical doctors love showing the full spine improvements that occur with the upper neck being corrected properly. Not to mention, if you break the low back and you sever the spinal cord, you don't go paralyzed above that point. You go paralyzed below. But if you break the neck, everything goes paralyzed. So the neck malposition, the neck neurologic interference, always affects the rest of the spine, and therefore is the reason why the atlas needs to be handled correctly first. With the increased accuracy of orthogonal chiropractic, we have higher expectations for correcting patients. The optimum goal for spinal care should be to get your spine to hold its own proper alignment, requiring less and less adjusting. These are the goals of advanced orthogonal care. So there's a concept in chiropractic that our job is to adjust people, and the more adjustments you receive, the better. Advanced orthogonal will focus on being as accurate as we possibly can, adjusting a patient gently into their genetic norm, removing all four misalignments with a single impulse, verified by post-X-ray and neurologic changes, and doing it in such a way by which we can get the vertebrae to stay positioned, to hold its own alignment. And by holding, the nervous system remains free and clear, and the body can go through its healing mechanisms the way it's designed and intended to. B.J. Palmer said in his book, The Subluxation Specific, The Adjustment Specific, that practicing with upper cervical principles, which he called HIO, is like placing people on various steps of a ladder. There's a bottom from whence they began and a top where they hope to arrive. As advancements and improvements evolve, new steps are added to the top. Each orthogonal or upper cervical practitioner will be found somewhere on a level of ascendancy between the bottom and the top. He went on to say, to hear any chiropractor say that he uses upper cervical, it may mean nothing, something, or much, in accordance to his understanding, mastery of its known elements, and his attainment of efficiency in combining all into one completed harmonious whole, and then constantly keeping on increasing his efficiency in application without slipping. You'll notice early on in his statement, he said, as advancements and improvements evolve, new steps are added to the top. This falls in line with the mentality of advanced orthogonal chiropractic care. This technique is focused on challenging the status quo in both healthcare and in chiropractic. We're forever looking for the next breakthrough, the next conceptual or technological breakthrough that's going to help us achieve better quality corrections to get people holding longer and get better results. And B.J. Palmer, 1934, told us that advancements and improvements should evolve in our profession. So we're working to add new steps to the ladder all the time. We're expanding this work worldwide, constantly working on perfecting this advanced orthogonal process of care. We have research being put out into the journals, being taught in the schools. We're teaching chiropractic seminars. We're actually involved in teaching medical doctors annually about upper cervical care. Working on managing successful groups at the clinic and business endeavors. We're trying to advance this profession through focus on quality of care. The successful business model is substantiated by a unique, valuable product, patient results that are extraordinary. Not ordinary, but extraordinary. And the public is looking for unique breakthroughs, unique services, unique results. And that helps to support and grow a business model that is second to none. When you graduate and enter the healthcare marketplace, you'll need to be able to stand out and be unique from the rest of the chiropractic healthcare providers. You'll have technology. You'll have digital X-ray analysis. You'll have laser and digital vector calibration. You'll have a percussion adjusting instrument. You'll have post X-rays to show a patient how well they responded to the adjustment. And with a full correction, getting people to hold the adjustment is in and of itself so unique to the marketplace. And then they heal. And you'll get the testimonies, which lead to the referrals of more new patients. And it's through results and education that you will grow a very successful practice. So please don't hesitate to ask questions, make comments, or even present new ideas. We're a technique that believes in challenging the status quo. If you would like to ask us anything, just feel free to talk to us at www.advancedorthogonal.com. And keep in mind that even Albert Einstein said the process of discovery is seeing what others have seen before and thinking something new. Our profession must advance, not just in diagnosing that a patient has nerve interference, but in the art and science of correcting subluxations. And Advanced Orthogonal is leading the way on those cutting-edge advancements that are going to be the future of this profession.